Okay, so good morning, good evening, everyone. Welcome to the Health Seniors, Human Services, Youth Education, and Human Rights Committee meeting of CB3. This is our monthly meeting. We do have a couple of very exciting agenda items tonight. But before we get into that, Larissa will explain the procedures of the meeting.
With me. Toggle back and forth. Okay, good evening, and thank you for attending our meeting meeting tonight. I would like to remind everyone that tonight's meeting is being recorded. At this time, we welcome all non-board members to sign in with your name and your affiliation in the chat box. Tonight, our chat will be used strictly for sign-in, materials distribution, and technical assistance. If you are experiencing any technical issues, please just reach out via chat and the facilitator will help you. In order to reduce background noise during the meeting, we ask that everyone remain muted unless you are recognized to speak. If you have any questions, again, just pop those in the chat. Thank you.
Okay, so the agenda will be the two main items will be a presentation from Gouverneur Hospital about their services and their clinics in our neighborhood. We'll have two presenters there. And then after that, we will have a presentation about a proposed safe haven right in our neighborhood. And I think it'll be maybe the first, we'll hear about it. Okay. And we have many people here from DHS, and the providers and the organizations who are involved in the safe haven. So before we do all that, let us have the minutes. I mean, we're going to take roll call for the minutes to, approve the minutes. Well, first of all, in terms of the minutes, are there any changes or to be made? Well, I don't see any hands raised, so I guess that means that everybody is okay with the minutes as it is. And Larissa, could you take the attendance?
Sure. Okay, Maylee.
Here, yes.
Thomas Rosa, he's absent. Larissa Shainberg, present. David Crane. Eric Diaz. Shirley Fennessy.
Here.
Shirley. Deborah Glass. Tatiana Giorgio. Sorry.
Yes, here.
Laura Lugo.
Present.
Paul Ringel.
Present.
Heidi Schmidt.
Here.
Vicky Wong.
Here.
And Carmen Perez. Okay.
Okay, so our first presentation will be from Gouverneur Hospital. And could the speakers kind of step up and identify themselves? I think there's two of you or three of you. You can unmute yourself.
Good evening, everyone. My name is Delicia Marshall. Can everyone hear me?
Yes, we can.
Good evening. My name is Delicia Marshall, and I am one of the community affairs team members for New York City Health and Hospitals, Gotham Health Gouverneur. I want to thank your board, your committee, for giving us the opportunity to present this evening. My role as a community affairs team member is to connect the community with the services that we offer through our outreach efforts. Whether it's in the form of health fairs or virtual presentations such as this, our responsibility is to raise awareness in the community about Gotham Health Gouverneur. We have a comprehensive list of primary healthcare services that we offer, which our Director of Nursing, Ms. Cheryl Lynn Ree, will speak to you in detail. Thank you. Ms. Ree?
Hello, excuse me. Hello and good evening, everyone. Thank you so much for the opportunity to share
information about what we do here at Gotham Gouverneur. We are located at 227 Madison Street in the heart of the Lower East Side. And if possible, I will share my screen with you so I can share a PowerPoint that has been prepared. Okay, the screening has been disabled, so that's not a problem. I can just go over.
what?
Oh, no, I can
well,
make
no.
you a co-host. I'm sorry. Wasn't sure if you were going to be presenting. Bear with me. Okay, Sherilyn, go ahead. You can, you should be able to share your screen now.
Okay, awesome. Okay, can everyone see this? Can
I
everyone
see
see
it.
my screen? It says Manhattan Community
Yes.
Board.
Yes, we
Okay,
can.
so we, hope to partner with our community in providing high quality, affordable care for the community. We are a true partner. Integral to Gouverneur Health is the fact that we've been servicing the Lower East Side since 1885. If you come off the FDR Drive, you can actually see the original building that has been refurbished for other purposes. But Gouverneur, the site at 227 Madison Street, has been modernized as part of a $240 million effort to provide optimal patient experience. We offer integrated, affordable, high-quality care and a true medical home. And a medical home is a place where the entire family can receive health care and build a relationship with their healthcare partners. We provide comprehensive outpatient services and a skilled nursing facility. Both facilities, both service lines, ambulatory and the skilled nursing facility, are affiliated with NYU. Our facility offers comprehensive healthcare services to the entire family. In the ambulatory or outpatient services, we have pediatrics, women's health, ophthalmology, dentistry, general medicine, behavioral health, rehabilitation, radiology, specialty services such as podiatry, surgery, vascular services, urology, and more. We also have the women, infant, children WIC services for our families, and we have a full service pharmacy as well as a drawing lab. The quality of care is high. Our patient satisfaction scores range typically in the 80s to 90s. Gouverneur Health continues to aggressively adopt innovative health strategies, and we facilitate positive patient outcomes through our population health programs and multiple other programs that we have spearheaded, such as our Light Clinic, which services patients with HIV-related diseases, our World Trade Center Clinic, which services patients that have had exposures and illnesses related to the World Trade Center. We also have a buprenorphine clinic, which services those patients that have substance issues that can be managed and regulated on an outpatient basis. And we also provide services to our patients with diabetes and hypertension and many other chronic diseases where we focus to improve their health in their present state and bring them to a better place if possible. Right now, Gouverneur is at the top of the list as the best outcomes in hypertension care. With our integrated partnership with NYU, many of our physicians receive their training there and come and continue to work with us for a long period of time. One of the things we pride ourselves in is the fact that our staff is representative of the community. It is important to us that we have language concordance. Our patients are able to speak in their primary language to their healthcare providers on all levels, from the patient care technician to the radiology staff, to the nurses and physicians, and many, many more. Our housekeeping staff, our security staff, all of their ethnicities are reflective of our community. The majority of our providers speak Chinese or Chinese dialect and Spanish, in addition to English. This provides an optimal patient experience and improves patients' outcomes because it helps the patients to understand us, and more importantly, it helps us to understand the patient. We see everyone regardless of ability to pay or their documentation status or citizen status. And that's extremely important to us. It isn't that we don't care about finances, we just care about patient care and outcomes and how to do finances in an intelligent way. And part of that is helping our patients to activate insurances that they fall into so that they can definitely use the services provided by those insurances, and not only clinical services, but outreach services and many other things. But for those who don't fall into a category where they can fit into an insurance plan, we will see them, and we have made provisions to make it either free or minimally expensive. The facility, we provide language support to patients who seek insurance options to make sure that they understand what it is they're opting for and what the responsibilities may be connected to that insurance. As a community resource, we provide support beyond the traditional healthcare, and this is where we partner with our community liaisons, where we have 2 offsites, Roberto Clemente Center, where they primarily treat behavioral health issues, but they do have a general medicine practice, and Judson Health Center, where we treat primary care patients, but we also have a concentration in adolescent transfer of care from adolescents to young adults to adult care, and also the LGBTQ community center that we have at Judson. The facility and outreach team are very active in the community. We partner with New York City ID Cares, health fairs, and open houses, which we did a lot more before COVID, but we are starting to reinvigorate that process. We do community screenings in different facilities, churches, firehouses, community centers, and more. We have a program called Reach Out and Read, where our community children can come in with their parents, and we encourage reading and do reading activities. And as I said before,
I'm sorry, could I interrupt you for a second? Hey, Larissa. Larissa?
Yes, sorry, I have to
Could
toggle
you-
between two screens. It
Okay,
takes me a
could
while
you,
to unmute.
okay, sorry, could you let some people in?
Oh, okay, sure. Sorry about that. I didn't realize that my participants room wasn't popped up there.
I think Deborah's waiting to be let in.
Sure. Yes.
And I don't know if there are other committee members.
Nope, just one.
Okay, thanks.
Thanks. I'll keep
Okay,
that
sorry.
on top. Thanks for
Okay,
the
sorry
reminder.
about that. So go ahead, please.
No problem. Gouverneur also has a skilled nursing facility, and the entrance to the skilled nursing facility is on Clinton Street. Both buildings are joined, but they do have separate entrances. The facility is an NYU Russ affiliated skilled nursing facility and rehabilitation center that they provide care for patients 24 hours for short or long-term care. They have a bed capacity of 295 beds, and they rate 5 stars with CMS. They are highly recognized, accredited by the New York Department of Health, affiliated with the NYU Russ Institute of Medicine. They are Medicaid and Medicare certified. And most importantly, Gouverneur has been ranked on Newsweek's Best Nursing Homes for 2022's list. They ranked 11 out of 618 nursing homes in New York City. And patients tell us in their own words what it means to them to have had their families cared for in our nursing facility. Things such as, I wanted to thank you again for helping get my mother-in-law into subacute rehab. I have visited multiple rehab long-term care facilities, both public and private. None of them came close to the quality of care that Gouverneur provided. My mother-in-law says she was treated like a queen. And that's just one of the many accolades that we get. I'm going to show you some pictures of what the skilled nursing facility looks like. This is the facility state-of-the-art gym. This is, they have the highest level of equipment to help patients on many levels have excellent outcomes. And they have an excellent reputation for getting patients back home who are here and do not need to stay. They get better and go home. They have private rooms with bedside phones. It's a hotel-like settings with flat screen TVs with cable. The patients have modern private in-suite bathrooms, dignified upscale areas, and caring staff foster a sense of community. The Gouverneur Skilled Nursing Facility offers many other levels of care. They have long-term residential care where it's a home-like environment with 24 hours of care and support. And they also get assistance with physical, emotional, and mental conditions. There is also a robust palliative care group that works with the patients for those with life-limiting conditions. There is also hospice care being offered at Gouverneur, and the interdisciplinary team of professionals and volunteers provide emotional support and pain control for patients and their families. We value our partnership with the Community Board 3 group, and we are committed to providing patients the best possible experience. This picture depicts one of the many activities that we've had over the years to represent our community. It was a day when we celebrated the Chinese New Year's. I want to thank you for allowing me to do this presentation, and I'm open to any questions that you may have.
Yeah, could you unshare your screen so I can just see some people? Thank you very much. Okay, so are there any questions? Yeah, so I don't see any questions right now. But it's a great presentation. I think Gouverneur is a really valued resource in our community. I mean, everyone I know goes to Gouverneur if they're going to a hospital, but unless they're going to one of the clinics. So could you maybe send us that presentation, and then also if you have any other initiatives or special programs that it seems like more like a general presentation of all the programs or all the services that you have, but especially if there's new things happening, we definitely want to know that, right now there is still a lot of people need information about COVID-19 and the vaccines and so anything you have available, we would definitely be interested. And also in terms of mental health, I think.
Okay, sure. I'll be more than happy to do that. I will send it to Delicia since she's the direct contact, so she can send it to you. And I just wanted you all to know one last thing, that we do have a very well-functioning, robust COVID vaccine center that is testing and vaccinating patients 6 days a week. And we are actually, tomorrow's the last day of our community campaign for flu. We've had a lot of visitors come to us. Thank you very much again for allowing me to present, and I will sign off now to Delicia.
Okay.
Thank you, Ms.
Thank you.
Reed. Once again, we thank you for the opportunity, Community Board 3, for allowing us to present. I will forward Ms. Reed's presentation to you, along with other information such as our vaccination hours, our testing times as well, so that you can share with the community. Anybody that's wishing to come out and get tested or vaccinated, we are here in the community to offer that service to you. Thank you once again for allowing us to present. And I will sign off now as well. Thank you.
Okay, thank you very much. Okay, so next group, are you all ready?
Yes, we are.
Okay,
Yes.
so our next item is a proposed safe haven facility at 91 East Broadway. And we have a whole team of people here to present about it. And as you all know, we talked about this in our committee quite a bit, and safe haven facilities are a priority for us. And it was on one of our budget priorities. It was actually number 6 on our priority. So it's fairly high and more important than ever. So why don't you start, or maybe you can introduce yourselves and then, start your presentation. Do you need to share something or a slideshow? Larissa could make the appropriate people
I think we're good on the slideshow. I think we're just gonna be talking.
Oh,
I think I'll kick us
no.
off, May, and then we can turn it over to Care for the Homeless to talk a little bit more. My name is Erin Drinkwater. I'm Deputy Commissioner for Intergovernmental and Legislative Affairs at the Department of Social Services. I'm joined tonight by Leilani Irving, Manhattan Borough Director, and Jennifer Wilcox from our Street Solutions team. I don't think I see anyone else from DHS, but if I've missed them, please just pipe in the chat. I really want to thank Community Board 3. As May said, you've included this priority in your budget responses each year. Department of Social Services and Department of Homeless Services has placed a real priority in expanding our work in terms of connecting New Yorkers who are experiencing homelessness on the street to programs and services. At the beginning of this administration, there were approximately 200 outreach workers who were working to engage individuals who were experiencing homelessness on the street. Today, we have more than 600 outreach workers across the 5 boroughs doing work to engage individuals who are experiencing homelessness on the street, working to get them connected to programs and services. We've also increased the number of drop-in centers, which is a critical piece of the puzzle in terms of getting people connected to programs and services. When this administration started, there were approximately 4 drop-in centers, not all of which were operating 24 hours a day. Now we have over 7, all of which are operating 24 hours a day. This allows individuals to come inside, to do laundry. There's not beds at these facilities. Typically there's chairs. But it does give individuals an opportunity to come inside and to get connected to social services and really continue to build trust with social service staff on the road to permanency. Tonight we're here to talk about a safe haven at 91 East Broadway. Part of our goal also has been increasing the number and capacity for these low threshold beds. They are a key element in terms of solving the homelessness crisis and really bringing people in off the street. When this administration started, there were approximately 600 of these beds. We now have over 3,000 with additional beds coming online before the end of the year. So I really want to thank CB3, who every year at the budget dialogue really pushes the agency to do more, recognizing the benefit of these low threshold beds for this population and connecting them to services. I don't want to talk too much about the program itself. I'm going to leave that to Care for the Homeless, but really want to talk tonight just about those investments that have been made. Through those investments, we've helped more than 4,200 New Yorkers come in off the street and remain off the street, getting connected to both transitional housing, but also more importantly, permanent housing like supportive housing. And so that work has definitely paid off in terms of the investments made for additional outreach staff, drop-in centers, safe havens. So with that sort of top line framing, I'd like to turn it over to Care for the Homeless to talk a little bit about the program that they will be operating at 91 East Broadway. And then certainly DHS is staying on and available to answer any questions. And we'll be here with our provider as well. Thanks so much.
Great, thank you, Erin. I'll just sort of go through with the individuals that are here from Care for the Homeless and also from our partners at AAFE. I believe Nelson is on right now, so I'll just introduce myself. My name is Natalie Interiano. I'm the Director of Policy and Advocacy at Care for the Homeless. And then Ron and Amir, if you'd like to introduce yourselves.
Hi, everyone. My name is Ron Lawson, and I'm the Chief Operating Officer at Care for the Homeless.
Hi, everybody. I'm Namira Nuzhat. I'm the Director of Operations and Project Planning at Care for the Homeless.
And then our partners at AAFE is, I believe Nelson's on.
Yeah, I'm Nelson Chan. I'm the Director of Real Estate for AAFE, Asian Americans for Equality.
Excellent.
Yeah, and I'm Thomas Yu. I'm the Executive Director of AAFE, and good to see my fellow CB3 members. Been on it for 10 years. I don't miss it that much with all the late night meetings, but I wish there was a Zoom back then when we were doing it. But good to see some of you that a lot of familiar faces.
Awesome, great. So we'll sort of start off with just to give you sort of an idea of like what CFH does and a little bit of our history. And I'll turn it over to my colleagues as well to give a couple more details about the program and then about our health center, which I think we'll talk a little bit about as well. So in terms of CFH, we were founded, or Care for the Homeless, we were founded about 36 years ago with funding from the Robert Wood Johnson Foundation, because there was a recognition that we really needed to create low barrier, high quality healthcare for people experiencing homelessness, so like the specific that population. Eventually, HRSA created a community health center program. So it started with that, and then HRSA took that on, a community health center program focused on specific populations, one of those being people who are experiencing homelessness, and those are known as 330H grants. So we're a network of federally qualified health centers funded through HRSA. So at this point, we operate 27 health centers across 5 boroughs. We used to be 4, and now we expanded to 5 of New York City, and we operate 2 shelters, one in the Bronx and one in Manhattan. And we're sort of go through like what that means. In terms of our health center, so we provide comprehensive medical and mental health services. And then we also provide specialty services, so things that are very specific to our population. So podiatry is a big one and dentistry is a big one. Our model, so it's shifted a little bit, but we started with, we go where homeless people congregate. That's the goal. And so that means we're in shelters, we're in soup kitchens, we're in drop-in centers, safe havens, we're at the assessment sites. And the goal is really to reduce barriers to access. Many times people who are unstably housed, we know that it's a specialty to try to get them to come in to accept services for several reasons. One of them is because they most likely have had a very bad encounter when going to try to get health services somewhere else, or they've been using health services more like emergent health services instead of ongoing. And so that's why we really try to reduce access to health services and being in places where they're congregating. Recently, we also moved to another model. It's a community-based model, and we created our first standalone health center in Brownsville in Brooklyn. And this has been in operation for 1.5 years. This is serving specifically people who are unstably housed in the community. We chose that location because we have there's family shelters there. There's also, it's mostly like family shelters, and they're operated by WIN, but that's the community that we're currently focusing on too. We also continue to grow our mission. So health centers obviously is a huge part of what we do. But 12 years ago, we made a determination that there was a need to open a shelter for individuals with chronic medical and mental health issues. And so we opened up a 200-bed shelter in the Bronx. And then we expanded in 2019 to a women's shelter in Midtown Manhattan, serving the same population. And both of these sites, we have an on-site health center. And this is the model that we employ for all of our transitional housing programs, is that we have an on-site health center. Again, that is to reduce the barriers to access, also understanding that addressing people's health is a huge help in terms of helping them exit homelessness. So housing obviously is a huge part of that, but also addressing their health needs. In the last 12 years, specifically for the transitional housing programs, we've been able to place about 1,200 of our residents into permanent housing. We also have 4 transitional housing programs currently in development. This includes a safe haven in the Bronx that's going to be scheduled to be open in December. And each of those programs also include an on-site Article 28 federally qualified health center, including the program that we're talking about today at 91 East Broadway. In terms of street homelessness, we have a very deep commitment to addressing street homelessness. We've long partnered with the street outreach providers in the Bronx and more recently in Staten Island to provide the street medicine services to their clients. We also have an on-site health center at the Living Room, which is a drop-in center in the Bronx that serves unsheltered individuals. And specifically the Safe Haven in Your program, I'm going to have one of my colleagues talk more about the program itself, but it's really a part of our Housing First for portfolio. So we're going to be placing a fully licensed FQHC on site as well, on top of all the other services that Erin mentioned as well. Although this is not really typical of the programs, we do think it's necessary. And this health center is not only going to be serving the residents of the Safe Haven, but it's also going to be serving people from the community. And then in terms of what CFH does in terms of our work with community members, so we're really committed to being engaged and responsive to communities. For each of our sites, our transitional housing sites, we have what's called the Community Advisory Committee, and that meets pretty regularly depending on the needs of the community. And it's really to monitor our impacts and also just to get suggestions on like what we can do for our program. And so we're more than happy to have community members join that. We can also come in front of the community board whenever necessary. So it's really a part of the work that we're doing with the community. Unless there's questions specifically about CFH, I'm going to turn it over to my colleague Namira, who's going to be talking about the program at 91 East Broadway.
So just to let you know, in terms of questions, we'll save it all for the end of all of your presentations.
Excellent. Thank you.
All right, so I will talk a little bit about the program design at this site itself. We're gonna, as usual, at most CFH sites, we have intensive case management and support services for our residents. So here we will definitely have a program director who's going to oversee everything, including security, case management services, move to permanency. So we will have housing specialists who will work with these who will work with our clients to get their paperwork in order to move them into permanent housing. Most of the time with clients like these, it's supportive housing is most appropriate, and you know, which it requires a lot of paperwork and applications and stuff. So we will have 2 housing specialists at this site. We will have 10 case managers along with the director of social services. We will have a recreation coordinator who will help these clients with sort of job training, if that's appropriate for a few of these clients. We'll get them into counseling sessions, group therapy, music therapy, and this is all to engage the clients so that they like the space and they want to keep coming back to the space, because especially at these at safe havens, the type of clients that these that the people experiencing homelessness are, they prefer to be on the streets. They are only you know, open to low threshold sites, and even then sometimes it's hard to retain them. So a recreation coordinator is also a key piece of the program to engage our residents. We will also have a CASAC because many of these residents will have substance abuse issues and long-term mental health issues. So CASAC is very, very appropriate for this kind of programming. So just to repeat, we will have a recreation coordinator, a housing specialist, a CASAC, a community benefits specialist, because these kind of residents are usually, you know, not very proactive in maintaining paperwork. And when someone's trying to maintain their benefits, paperwork is a very key thing. You know, not only acquiring benefits is enough. Sometimes people have to reapply, resubmit documents and stuff. So a community benefits specialist will help our residents acquire benefits and retain them. We will have, in terms of the site management, an operations coordinator, a facility manager, program aides. So all kinds of assistance that is beneficial to our residents will be available, be it in terms of case management, mental health support, substance abuse support, recreation, as well as spatially to help move stuff, to help get into the site, to help get somewhere they need to help get them to appointments that's useful for them. So I think that pretty much covers what I wanted to mention in terms of the programming and support services we will have. We will also have very robust security within this facility. We do our own security. We will have a director of security and safety monitors, and at any given time, there'll be about 6 security personnel who will walk around the building itself and monitor CCTV cameras. We will serve freshly prepared food. We don't have our own kitchen, but it's still freshly made, freshly prepared daily food that will be served to our residents. And we will have certified food certified workers who will serve and manage the kitchen. I think I covered pretty much the programming. Ron, if I missed something, please jump in, and then I hand it over to you.
Sure. I just want to speak briefly about the Article 28 that we'll be building on the first floor. It's about 2,500 square feet, and it will provide primary care, dentistry, ophthalmology or optometry, podiatry, and behavioral health. We at Care for the Homeless follow the mandate that George Nashak, our president and CEO, established when he got here. His mandate was that the healthcare we provide folks experiencing homelessness should be equal to or superior to any of the health services that any of us receive on this call. So when you walk into one of our Article 28 health centers, it will have the look and feel of a city MD or an urgent care center, because we want to make sure that the residents and the folks experiencing homelessness that we serve feel like they're going to their doctor. It's not transactional. We are a patient-centered medical home as well, as you heard the young lady from Gouverneur talk about the services at Gouverneur. We've been certified as a patient-centered medical home by the federal government, by HRSA, for the last 10 or 12 years. Care for the Homeless is the largest nonprofit healthcare provider solely to people experiencing homelessness in New York. When you come into our health center, you will not come into a Care for the Homeless health center. You will come to a Care Found Here health center, because that is our outward facing look to the community and the folks that we serve. We have found that if you can get someone healthy and you can get someone stabilized, the next step is you can get them in supportive housing with the wraparound services that individuals need. So for us, healthcare equals housing. It will be about, as I mentioned, 2,700 square feet, a full complement of physicians, nurses, nurse practitioners, and medical assistants working to provide the services to the folks in the community who are experiencing homelessness, as well as the residents of the Safe Haven.
Thank you, Ron. And then Nelson and Thomas, we're partnering with AAFE, which I think most of you know that. And do you want to talk a little bit about that partnership? And then we're also speaking in terms of the programmatic aspect of providing the language and cultural competency aspects of this.
Yeah, sure. I can go a little into why AAFE was interested in this project and started, piecing this together and, working with CFH and DHS on this site. I think many of you know, right before COVID, we had that terrible tragedy when four members of our community were bludgeoned to death, right? And there was such an outpouring of, grief and support for these folks. And it also highlighted an issue that I think CB3 and all of us who are especially in Chinatown and other neighborhoods around the city know, that there is a really high hidden homeless component, particularly amongst Asian Americans and Pacific Islanders in poverty. We're seeing that in a lot of our services. And while we don't only serve AAPIs, we do see that this is a big need and something that we all are seeing in Chinatown and the Lower East Side as well. And this is why, we are here committed, to provide the language and the cultural competency, the translation, helping folks navigate processing and through the system of being a bridge to permanent housing. And this is what this facility really means for all of us. And we couldn't have gotten a better partner than CFH to help us with this. We're also adding, the clinic that they've been talking about is asset, not only people who go and live in the building, this is for the public, that adds another clinic to Chinatown. And so we're 100% committed. We are neighbors. We have two offices headquartered right by a block away. So, if there's any issues, we're there. We're here to also, as you know, we run a small business CDFI to work with, folks along the commercial corridor to make sure this is seamless and make this, a really well integrated facility, in Chinatown. And so we think this is something that's long needed, and we know that CB3 also has identified safe havens as a top priority in the district.
Thank you, Thomas. So I think that's, unless Nelson, you have anything to add? I think that's our presentation. We'd be happy to take questions or however you structure this.
Okay, so I will take questions and answers from all at this meeting. The generally I will take questions from the committee members first, but I know there's a lot of non-committee members or members of the public who are here also at the meeting and might want to ask questions. So you will have an opportunity to ask your question. But before I start that, as you all know, Susan Stetzer, our district manager, is on vacation now, so she couldn't be at the meeting today. She's in a very nice place right now, with having a good time, I'm sure. But she did leave some comments, some remarks that she wanted people to hear. So I have the comments here and I'm going to read them. It's quite short. So here it is. So for years, we've heard from NYPD and outreach workers that people living on the street, especially adult men, will often not accept a bed in congregate shelters because they're afraid. The facilities are not considered safe. I've also heard this directly from some people living on the street and have read this in many interviews. It is more likely that they would accept beds in safe havens. However, they often want to stay in their neighborhood. I've been told by outreach that there are beds available, but not in Lower Manhattan. I think additional safe haven beds in our community will create better success in having people accept services and beds and begin the path to housing stability. Also, I remember reading that Chun Kwok, one of the men killed in Chinatown, had been in a shelter, but he spoke only Chinese and there was no language access in the shelter. That is heartbreaking. It's a heartbreaking situation. And this safe haven, which will be named after Chun Kwok, will be the only safe haven I'm aware of that will have access to all 3 Chinese languages spoken here. Okay, so that's so she just had those comments she wanted people to hear since she is not here. All right, so yes.
May I apologize? I can't raise my hand. Before you get to the questions, I just have a quick one for Namira, just for the notes.
Yeah.
Namira, you mentioned case ag. I think I'm not sure what that term
yeah,
is.
yeah.
Okay. What is that exactly?
A CASAC is someone who specializes in substance abuse services. So they are also social workers, but they have lived experience of, substance abuse and dependence on, substances, and they help our clients through counseling.
Okay, and is it, how do you, CASE?
I will
AG?
give you the exact breakdown.
CASAC.
Credentialed
CASAT,
alcoholism.
thank you.
So it's credentialed alcoholism and substance abuse counselor.
Yeah, that's right.
I have to Google it quickly if I say it wrong. So it is pretty long.
I'm sorry, can you give me the letters again? I apologize.
Or could you put it in the chat?
Or put it in the chat. Yeah, put it in the, yeah, drop it in the chat. Thank you.
Yeah,
I appreciate that.
no problem.
That's great.
Okay, great. So there is a question from Heidi Schmidt.
Hi, everyone. I actually have like 3, 4, 5 questions, something like that, but I'll try to ask them quickly. So I wanted to know, you said you'll have a psychiatrist or a psychologist, I'm not sure which, and social workers, and I wanted to know how many you will have at the site and if they're going to be there, if one of them will be there 24/7, or is it certain hours?
So should I get that?
Go ahead, Namira. Yeah.
Yeah, so in our health center, we will have a psychiatry MD and a psychiatry nurse practitioner. And in the staff, we will have case managers and the shelter director and the director of social services, who are trained case managers and who are trained social workers. So they are very well adapted handling situations if something is to arise. And in the health center, we will have psychiatrists. And I would like to mention that while psychiatrists are doctors and they prescribe medication, they're not necessarily the best person to handle an emergency, if that's what you were thinking about. Caseworkers, social workers are better trained to handle situations.
Thanks for that. So, but with the psychiatrists or the psychologists who are on site, are they there like once a week? Is it every day?
So they will be, the psychiatrist will be there twice a week, and the psychiatry nurse practitioner will be there once a week. And the director of social services and the case managers will be there all the time, 5 days a week, and at least from 9 to 5.
And just to add to that too, so we're, as we mentioned, we're a network of community health centers. So whether or not they're on site, they are still connected to our services. So
yeah,
especially now, we always had this before, but especially during the pandemic, we really moved to a telemedicine model. And so they always have access to one of our psychiatrists at any other one of our health centers. And if there is a need for it, so it's always based on need. We sort of staff thinking this is what we're going to need. And if that need increases, then we obviously go back and reevaluate that.
I also want to add that all our security staff and shift supervisors, who are the people who manage the site, are trauma informed, and they will all be trained to handle incidences and to manage situations. So they will get specific training to avoid or to handle situations when someone's having a breakdown or some kind of, between two residents or anything. They are trained to be able to handle situations.
Mm-hmm. Okay. And then I think maybe it was said implicitly without, explicitly stating it. So are you going to be prioritizing a certain number of beds or a percentage of people who come from Chinatown or the Lower East Side, or how are you kind of setting aside a section for local people?
So I can talk to that. So as was mentioned, part of the success of stabilization and safe haven beds is having them in the geography or the communities that individuals tend to bed down or are residing in. And so it was in Susan's comment that she made in talking to people and people turning down beds that are outside the vicinity that they're, bedding down in and familiar with. Our teams can speak to that, that generally, that is an experience that we see, where if there's a bed offered to somebody who is within the confines of CB3 up in, say, the Bronx or out in Queens, it's likely that they're going to reject that bed because of the proximity to the community and neighborhood that they're familiar with. So we do try to prioritize that, and part of the placement within CB3 is responding to and recognizing that within Lower Manhattan, and particularly CB3, there's not this type of capacity. So it is the goal, and based on the successful safe haven model, folks will largely be coming from the community. It won't entirely be, but that is part of the benefit of the program.
Thanks, Erin. So they're going to be coming, basically the local outreach group. Who is the outreach group that's doing outreach here?
So it's part of the Manhattan Consortium.
Goddard, yeah, and Goddard is contracted out here as well.
So basically you will get referrals, the site will get referrals from Goddard.
And that's Erin expressed in my Manhattan Outreach Consortium.
I'm just thinking about I think a lot of us probably on this call, I don't know if, Goddard is familiar with folks. They probably are with some and some, not others, but there are definitely a lot of people, I think increasingly so during the pandemic, that we could give some information about.
Yeah, I mean, we'd be happy to. Heidi, you're welcome to send that information to myself or to Leilani. We can share it with Jennifer and the street outreach team to make sure that they're in communication with Goddard. We find those referrals to be particularly helpful because oftentimes folks in the community have built relationships with the folks that they're seeing in the neighborhood.
Right, thank you so much.
Just to add to that, can you all hear me?
Yeah.
Okay, great. Sorry, my Wi-Fi, everyone's been freezing a bit, so I'm not sure if you all can hear me. I do, as you all know, I know that CB3 is extremely engaged and active and involved, especially with the street homeless community, and works really closely hand in hand with our provider Goddard. And it was discussed, with Susan Stetzer, and I believe May, you were on the call as well, that Care for the Homeless is committed to work closely with Goddard and DHS Street Outreach to work on, in a more coordinated way to identify individuals in the community that's, entrenched in this community, and to flag those individuals. Those individuals will be on Care for the Homeless radar. So they've agreed to work more in a coordinated way with our outreach providers to flag who those people are in the community. And Goddard has their pulse on this community when it comes to knowing who is the most vulnerable in this community district, and they're extremely engaged with CB3 and with the leadership of Community Board 3. So just wanted to share that Care for the Homeless is committed to work in a more coordinated way with these contracted providers in DHS Street Homeless Outreach Unit that Erin spoke to, Mock.
And just to add to that, AAFE will also have staff as part of the service providership as well, included to participate and assist in the outreach.
You mean in the street outreach? What
Yes.
did you mean by the outreach?
Yeah, for
Yes.
example, just as you know, there's many hidden homeless. They're not conventionally where you're going to find them. And it's like in the flop houses, in our temples, in our churches, right? They're pulled up in these transient beds, right? In the tenant. So this is where we're going to also help inform and outreach and educate folks, so that we're putting it all towards like the existing consortium, so that they can get a better understanding and feel more secure in entering safe.
Oh, okay. Any other questions? I don't see a single hand raised. How can that be?
Because May, you guys engage with us often. Just kidding.
Well,
I don't see any hand raised either, but I will say that if there are additional questions, I know that Leilani makes herself available. I want to make sure that folks know they can reach out to myself as well, and then certainly the team from Care for the Homeless. This is one conversation of many. I know that the full community board isn't represented tonight on the committee meeting, but happy to answer any follow-up questions for sure.
okay. Yeah, I did have one question about you're going to build some sort of a clinic on the first floor, right? So that clinic, it provides healthcare services. So is that to the residents only? Because I know you said you had you are like a certain designation where you provided healthcare to those who are unstably housed.
Yes.
That's your general designation, but so for this clinic, are there services to people who are unstably housed but not yet in that safe haven?
It will be open to the community, to those folks who are experiencing homelessness and unstably housed, in addition to the residents of the safe haven.
Oh, okay, so how would they know about it? I mean,
Well,
outreach or?
Outreach.
Okay.
May, sorry, I have one question related to the health center as well.
Oh, okay, go ahead.
So for the health center, for cases that you cannot, that are above the services that are provided in the Article 28 facility, are you associated with any of the hospitals like Gouverneur, which is right here in our community, or NYU, Mount Sinai? What are your affiliations?
Natalie, do you want to address that?
Yes, we do. So with anything, as you said, so our stuff is primary healthcare, and if anything that's a specialty service that we can't provide on site, then we do have sort of a network of referral processes. I'm sure that especially with this one, that we will add the network to capture sort of the lower Manhattan area. But absolutely, we do have places, especially where we know, because we know with our clients, the kinds of insurance that they have as well, if they end up coming with insurance, or if they're uninsured, the kinds of places that will be able to offer them the services that they need. So we do have a big network for that.
Oh, Deborah, did you have your hand up? Okay, go ahead.
At first, I was going to say I didn't have a question. I just wanted to make a comment that this was a really comprehensive presentation, and I appreciate like all of the things that you all covered. It was really well rounded. But then I guess a question that occurred to me was what's your catchment area, if there is such a thing? Are there like, what are the borders or boundaries that your teams would be working in and who you'd be dealing with on a regular basis?
So the Manhattan Outreach Consortium, so Goddard Riverside, is primarily the provider doing street outreach in this vicinity. So placements would be coming from that group, making referrals to the Care for the Homeless location on Broadway. We do have the entire island of Manhattan that's covered. And so what happens is, again, we talked about the fact that with stabilization beds, one of the things that we find to work most frequently is geography, right? Just like you and I don't like to change our patterns or our behaviors, somebody coming in from off the street, having something that's, in the general vicinity of where they're bedding down is quite helpful. But it doesn't mean that somebody who, on an evening that we have a vacant bed, and the team's been able to make progress and they say yes, which is a great step in terms of that transition back to permanency, that we wouldn't then place them if they accept a placement in Lower Manhattan at this location, right? So again, priority is in the neighborhood. We know that that's what tends to work best with the safe haven from a client point of view in terms of getting them to accept the service. But we run, a citywide operation. And so any vacancy is taken into consideration when placements and referrals are made. I hope that answers your question. It's a little all over the place, but hopefully it does.
No, that was fine. Thank you.
So there is actually no, Susan said that there was actually no safe haven or with beds in Lower Manhattan or there are few in Lower Manhattan. There are not enough.
I'm trying to remember, Jennifer, do you have the count or what the sort of like next closest safe haven is here? I'm sort of drawing a blank. I apologize.
I have to admit geography isn't my strong point, so give me 1 second to look at the matrix and see if I can figure it out.
Oh, okay. Oh, so there might not be one.
I know we have some in Midtown for sure. But again, that's far away.
Right. Yeah, okay.
I'm thinking sort of like below Canal. I'm not recalling anything.
Oh, okay. Yeah, well, this is okay. So what is, oh, wait a minute. There are no other hands raised right now. So what are the next steps? I know you talked, you talked about like, reaching out to, in your presentation, in your handout, you said it would probably open in 2023 at the end of it.
Yeah, that's a projected date. We try our best given all of the uncertainties in terms of construction and development. We're happy to provide regular updates to the community board as construction progresses and we are closer to an open date, being able to take the members of the community board on a tour to be able to see the facility. We can arrange all of those things in due time.
Oh, okay. All right, and then you're doing more. Are you doing more outreach with like the neighbors and it's a commercial street. It's a busy commercial street, and there are other businesses there and all that stuff. So this will be a new thing for them, for sure.
Yes, certainly.
So is there any outreach being done there?
Certainly. I think AAFE will certainly be a big part of that in terms of reaching out. One is identifying who they are and who we need to speak to, and then doing that outreach. Absolutely.
Okay, good.
Yeah, we supported a lot of those small businesses during COVID through our small business emergency capital program. And then specific to that site, it was also really advantageous for this type of facility because there's multiple entrances, so that if one gets too crowded on the commercial main street, we can always activate the side entrance, which is like on Henry instead of East Broadway, or on the side of Forsyth. So it's a really neat building that we're able to have those other means of egress.
Oh, okay, on the back side. Okay.
Right.
All right. Paul, did you have a question?
Yeah, just a point of clarity. It's scheduled to open in summer of 2023. That's correct, from what I read on the letter.
I believe, yeah, that's right.
And I know that's the anticipated opening. Is it possible it could be closer than that or further than that, or is that like
it's possible?
How does that date work?
Construction in New York.
Okay.
I feel uncomfortable saying one way or another. As we make our best estimate, what we can commit to is coming back to the board to provide regular updates.
Okay, well, thank you. I appreciate it.
And also, not to promise anything, but AAFE has developed other affordable housing projects and very familiar with construction and construction management here. There's other ones in CB3, and as you know, they're ahead of schedule, actually, which is unheard of for a city project. So, but not promising anything.
Good for you, Thomas. Good for you. I know that's definitely not always the case.
That's impressive. Yeah.
It's pretty good.
And yeah, shameless plug. We're tell folks about the housing lottery for the Houston Street affordable housing project we have right now. So.
Great. That's great.
Okay. All right. Okay, great. So I don't see any other questions, but we will just, keep in touch and follow up, and, let us know if you need any help. I think AAFE and the other left that you're working with probably have identified a lot of other parties and organizations to talk to, but, you can always,
And if I can, I'd just like to take another opportunity to really thank CB3, Councilmember Chin, and the community. You have really stepped up after the tragedy that occurred a couple of years ago to really push the agency to bring stabilization beds to this area, recognizing the longstanding need in the community. And so we really do appreciate the partnership from this committee, from the board as a whole, and look forward to the day that the site opens. I think it's a really special project, and I'm really excited that we had the opportunity to share the details of it with you tonight.
Okay, great. Heidi, did you have another question?
Yeah, sorry to leave it to the end. I was trying to figure out how to ask it. I'm wondering if Erin or if anyone from AAFE, how and if you're foreseeing, I guess, what the pushback from the community at large would or may be, and if there's ways that we can support you through that, one, and then two, if any part of that pushback from the community would be, race-based, if there are ways, again, that we can support you through that process.
Yeah, that's a good question, Heidi. Thank you. And as somebody who's familiar with this work, I think that the challenge is that a lot of people will read about a shelter or safe haven and really tie that to other media coverage around individuals experiencing homelessness. So, largely focused on the sort of media coverage of anybody who has had the experience of being homeless, and not on the sort of compassionate work that our providers do each and every day, working to connect people to the medical, mental health, and social support services that they need. And I think one of the things that we talk a lot about is that, having the outreach teams, the sort of biggest problem, or one of the big problems that they can encounter, is that when a client's ready to accept services and we're not able to offer them the thing that they're ready to accept. And for better or worse, that happens with this particular population because of the low number of beds that we have. And so this is an opportunity where we're continuing to build the trust with individuals, and making sure that we have the resource available to continue on that progress is really important. And so a lot of people get concerned that conditions in their neighborhood will deteriorate because of the presence of this type of facility. And we like to remind people is that in many cases, the conditions in their neighborhood are there, right? We've talked a little bit about the already existing street homeless population in this area and the lack of particular services available to them. And so this will better match the need in the community with the resources that will help address those concerns and those needs. We'll also be able to continue that dialogue. So if there are questions that you're starting to get, please feel free to reach out. Happy to work to respond. But I think having this project that has culturally competent partnerships will be particularly helpful in terms of just like responding to the issues overall.
Okay, great. Paul?
Yeah, I just want to follow up.
Yeah,
Heidi, are you done?
No, go ahead, Heidi. It's fine. Go ahead.
Yeah, I wanted to just ask, like, AAFE, and I'm just seeing like a big part. So, a lot of street homeless people in general, because of some of the issues that they have, there are unfortunately, there are trends to this in terms of race. And I'm just wondering if AAFE has, not all of the people that come into this safe haven will be Asian or from the Chinese community, and they will not all be from the local community. And so I'm just wondering if the local community will accept people and how we can help, and if AAFE can help the community at large to accept people who are from outside the neighborhood, who are not Asian, etc. If there's been any thoughts or,
Yeah, no, thanks for that question. We actually have been thinking about those issues for years. Actually, we've already started in advance of this project, really talking to a lot of other, Chinatown, Lower East Side stakeholders to gauge kind of like their temperature and impressions. I think they're actually very welcoming. This is something refreshing to them. They know that it's not only going to be one specific group or the other, but the fact that this is the first time there's even a facility that has that cultural competency for people who speak Asian languages, that's a huge win. And they understand that this is a very different type of facility than the ones that they have heard all the horror stories about, and that they're also reassured that we're going to be around. A lot of times, there's a criticism you hear, and often it's unfair, but then you do hear sometimes that, oh, there's this group that they're not from the community and they're creating this type of facility in the community. And so having a known entity helps a lot. We're also helping a lot of the small business owners who tend to kind of have a bad reaction when they first hear about this, but then it's also based on that kind of decades of trust and support we gave them through our economic development programs. Is it going to zero out all opposition? No, we wouldn't be, foolish enough to think that way. But then we would appreciate any support you have. But then we're also out there talking to a lot of folks, and so far we have gotten very good feedback. And once we explain what the nature of the safe haven is and what it is not, what the clinic services provide for the community, and so and what it could mean for a lot of the hidden homeless that we see in our neighborhood that don't get captured. So this is something that we're seeing much less, I guess, NIMBYism and opposition compared to other parts of the city when you do see these kind of facilities take place. So.
Thanks. I'm glad to hear you thinking about it.
Paul?
Yeah, I was just thinking about what Heidi was asking just now. Maybe there's a way as a committee we can memorialize what we're saying is that in just the presentation. So maybe in a resolution form, maybe not tonight, but at some other point where we can formalize our support. That's questions for you, May, or anybody else.
Okay. That's all you wanted to.
Well,
say, that we
maybe
should-
as a next agenda item, maybe in a future month going forward, that we memorialize this conversation and formalize our support for it, just in case.
Yeah, I mean, we already support safe havens. And it's going to happen. So it's not like we're asking an agency to make it happen, because they are making it happen, right?
But just to be specific.
But
I
yeah,
guess.
but just, maybe, or to actually do something, we could do that. It doesn't have to be a resolution, but do something, some kind of activity or action that, supports it and, makes it even, better and more acceptable in the community if we think that's one of the issues.
Sure.
So yeah, so we can talk about it. Okay, so now I no longer see any hands raised. Okay, great. So we'll keep on talking, and we'll be following up. And please
Thank you,
let us know
everyone.
if you have anything else you need for now or later on. Okay.
Thank you so much.
Okay, thank you very much,
Thank
everyone.
you very much. Appreciate
you.
your time.
Bye-bye.
Okay. Thanks for coming. Okay, so we are pretty much at the end of our meeting. The next thing is, are there any CAB or CEC meetings to report on? Yes, Larissa.
I did attend the Gouverneur CAB. I was hoping Eric would be here, so I would really like to hear his take on the meeting. It was a very difficult meeting because we were advised by Gouverneur that we are coming in over budget for the urgent care that our committee has been working on and advising on for quite some time. In fact, Eric has been participating in quite a number of meetings for this new space to get urgent care to connect with Gouverneur. And we were advised that basically they will not approve anything that is over budget. If they are planning on, if the budget is going to be losing money for more than a year, it's a no-go. So they came up with alternatives. There was a lot of pushback because we were told that if we do not act within less than 2 weeks and put together a proposal for that space, that we would lose the money. It would be taken away from Gouverneur. So there's kind of an urgency to get a plan in place, whether it's an urgent care or another type of facility. And Dr. Gagliardi came up with 3 alternatives. One was a diabetes center, one was moving the World Trade Center into that space, plus, oh goodness, I can't remember the name of the type of facility. It wasn't an urgent care, but it was type of a walk-in center, kind of after hours telemedicine, so that after Gouverneur is closed, if you have an emergency or a medical situation, that you could call in and get care, advice, and direction. The problem was that we had worked so hard and we were never advised of this deadline and the fact that we would be losing this money. So we have asked Gouverneur to ask for an extension so that we do not lose the money and we can get more advice from the Council of CABs regarding budgeting for the urgent care and see if we can still manage to get this, because Woodhull had the same situation where they were going to get an urgent care and it was lost. And we don't want to repeat that. If we really need an urgent care, we need to get that urgent care in here. And that's one thing that we really need to look at, what is going to serve best in that space. But to be continued on that subject.
Okay, so just keep us updated or let us know
Yeah.
there's some sort of
Yeah, we're
something that
planning
we
on
need
some-
to do or something.
Yeah,
like
we're
that.
planning some outreach. I will. Yeah, we're planning some outreach meetings with Woodhull and the Council of Cabs to get some more advice on what to do with the situation so that we can be part of the process and we don't just feel like we are left out in the community.
Okay. Anything else? Ricky, did you go to a cab meeting?
No, I reported out last meeting that, but there's no upcoming caps.
Because they only meet 4 times a year, right?
Yep.
Okay. Tati, did you go to the CEC meeting?
She just posted something in the chat that she's having some technical difficulties. She has nothing to report other than there's a legislative breakfast for the CEC coming up in a few days.
Yes, there is a legislative breakfast. I think it's used to be in person, but they do it every year. So this year it's on Zoom. It's on a Friday in the morning, and Susan and I have been to it. So usually it's a legislative. Yeah, usually it's a legislative breakfast, and usually a lot of the elected officials that are there and the schools and the school leaders, talk about their needs. So we went there maybe 3 years ago, and able to hear from them what their needs are, and and there were things that we could help with. So just so we plan to go to it again, and it's very good. Okay. Deborah, you put a note in. Okay, we'll note that later. Okay, is there any other questions or new business or old business? All right, well, if not, then we will take the final roll call and have a vote to adjourn.
Wow, this is a record. You've speeded quite right along. Okay, let's do final roll call. Mei Lee.
Yes.
Thomas Rosa. Larissa Shainberg, present. David Crane. Eric Diaz. Shirley Finnessy.
Here.
Deborah Glass.
Here.
Tatiana Jorio. She's here.
She's having technical difficulties.
Sorry, Jory. Tati. Laura Lugo.
Here.
Paul Rango.
Yes.
Heidi Schmidt.
Yes.
Ricky Wong.
Yes.
And Carmen Perez.
Oh, she's not here.
Got it. Okay, that's it, May.
All right. Okay, so the meeting is adjourned, and the next full board meeting will be on it's on Tuesday, November 23rd. Okay. All right. Anything else? Any like things that you want for December? We don't have a real December agenda planned yet. Okay, well, if you have, just send me an email and we can talk offline. Okay.
Right.
All right.
Night.
Bye-bye. Oh,
Everybody.
Larissa,
Hopefully
send
I'll
me
have-
the chat right now.
Yes, I'll send you the chat now, and hopefully I will have something for Gouverneur to put on the agenda. So
Okay.
maybe we'll
Turn
have a
off the
decision.
recording for a second.